Welcome to today's webinar hosted by the American Academy of Pediatrics and HealthyChildren.org. Today we'll be discussing respiratory syncytial virus, or RSV, a leading cause of hospitalization in infants under 1 year of age. We'll also share the latest guidance on protecting your baby, including the new prevention strategy known as nirsevimab, which helps reduce serious illness from RSV. Before we begin, a few housekeeping items. This webinar is being recorded. If for some reason you lose your connection or need to drop off, you can access the archived version on our website in a few days. If you have technical issues during the webinar, go ahead and use the chat function to send us a message. We will have time at the end for a question and answer session. Feel free to send your questions in at any time and we'll get to as many as we can. Now let me introduce our host, Dr. Jennifer Shu. Dr. Shu is a practicing pediatrician, author, and mom in Atlanta. A frequent guest on national and local TV, radio, and web-based programs, Dr. Shu is the co-author of the AAP books Heading Home with Your Newborn and Food Fights. She's also the medical editor of HealthyChildren.org, the official parenting website of the AAP. Welcome, Dr. Shu.
Thank you so much for having us today. We are here to talk about RSV, and the season is already starting. I'm seeing it in all age groups, from birth even up to school age kids. And with the infants being most severely impacted, we have invited to talk to us today about RSV prevention, Dr. Joanna Parga Belinkie, a neonatologist who is a baby doctor and a lactation consultant. She does clinical time in both the neonatal intensive care unit and in the newborn nursery with healthy babies. Dr. Parga Belinkie works in Philadelphia, where she is the director of a newborn nursery at the Hospital of the University of Pennsylvania. She's a member of the American Academy of Pediatrics, or AAP, Council on Communications and Media Executive Committee, and also a co-host of the AAP flagship podcast, Pediatrics on Call. Welcome, Dr. Parga Belinkie.
Thank you so much, Dr. Shu. It's a pleasure to be here.
So why don't we just get started and talk about the basics? What is RSV and why are infants at greater risk of infection?
So RSV is respiratory syncytial virus. So it's a virus, and a lot of times it acts like the common cold. So the symptoms can be runny nose, cough, a lot of mucus. I always say it's like a very sticky, mucusy virus. And the reason why we worry about it so much in infants is that it can actually affect how they breathe. And so a lot of times when I see babies in the NICU that get admitted because of RSV, it's because of breathing difficulty. And remember, it's the sticky, mucusy virus, so that contributes to it. And, also it's a virus. It can cause fevers. It can cause decreased appetite, decreased energy. So sometimes that's another reason why babies need to go to the doctor, because they're just not taking in enough milk in whatever form and not hydrated enough because of the virus.
So let's say a parent suspects that their child may have it. How would the doctor then diagnose RSV?
So diagnosing RSV can't really be done with a chest x-ray or any of those studies. It's really done with a nasal swab looking for viruses. And of course, you have to have the symptoms, right? So kind of the things I was talking about: runny nose, cough, congestion. Fever is always an emergency in babies. So if you have a baby who's less than 2 months old, you're really going to want to get them evaluated if they have a fever by their pediatrician or even into the emergency department. And so getting the baby seen, looking for those signs and symptoms of a virus on physical exam, getting that nasal swab. And then x-rays can be important if you're looking for sort of spread of the virus or evidence of something like pneumonia, which can be kind of secondary after getting a virus. You can get a bacterial infection, but you're really going to diagnose it on that nasal swab.
Okay, so once you know that your child has RSV, what can parents do to help them feel better?
Yeah, it's not every baby that's going to get hospitalized with this virus, thankfully, right? And there's a lot you can do at home to help support baby if baby has RSV. And a lot of it, it's called care and comfort on this slide, but we also call it supportive care. So things like getting that mucus out. So there's a bulb suction in this picture, but you can also get those snot suckers, and some of them are automatic as well, but I like the manual snot sucker that has a filter, so you're not sucking the snot into your mouth, you're just sucking it out and it's getting trapped in the filter. A humidifier is really helpful. And also when you're sucking the snot, humidifier and nasal saline kind of does the same thing to break up mucus in the nose. You can get it out easier and help with breathing. And then, we don't want these babies to get dehydrated, and sometimes they're going to just have less energy and be less wanting to feed. So making sure you increase number of feeds, keep track of feeding, keep track of diapers, because that's a good way to know about hydration. You should have about 7 or 8 wet diapers a day. And so that's a good marker for following how hydrated they are and making sure you're giving enough fluids. And then remember, fever under 2 months, you want to get seen by a doctor or go to the emergency department for a baby, because that has to be evaluated. But once you're over 2 months and you have fever, it can start to be managed by over-the-counter medications. And we have on here acetaminophen, which is Tylenol, or ibuprofen, which is Motrin. Motrin, remember, you can't use until baby's 6 months old. So that's going to be a little bit your older baby, right? But then you could use those fever medications too, and also for comfort for babies who are really not feeling well from the virus.
So for parents getting ready to bring baby home, what other kinds of things might they want to have on hand? And we can go next slide.
Yeah, that's a great question. So how can you prepare yourself for supportive care at home? So you heard me mention something to get snot out. A lot of hospitals will send you home with a bulb suction, but you can get one of those snot suckers at home. It's always a really good idea to have a thermometer of some sort. It could be under the arm. They sell rectal thermometers. There are forehead thermometers. So there are different types of thermometers, and a temperature is over 100.4. Okay, so that would constitute as a fever, but having that at home so that to check if your baby feels warm, if they're not acting like themselves. And the other thing is a humidifier. They're a little bit hard to keep clean, but having a nice humidifier in the room is another good tool to have at home to help comfort your baby if they have RSV or any virus, really.
Any thoughts on having some type of pulse oximeter that can measure a baby's oxygen level at home? Well, I know we
Yeah,
use them in hospitals.
we definitely use them in the hospital. I'm so glad you brought that up, Dr. Shu. I mean, that's something I use every day in my practice because I'm in the NICU, right? So I have a lot of experience with pulse oximeters. The ones we use in the hospital, though, they're FDA approved. We're watching them. So you're professionals that are watching the pulse oximeter at all times. So that's why I don't universally recommend pulse oximeters for all babies. Now, there are certain types of babies, if they have more high-risk conditions or they have a need for home oxygen or something of that nature, that may use a pulse ox at home. But the reason I don't love the over-the-counter ones is because it tends to be a lot of false alarms, and it tends to pull parents away from actually watching their baby. And the signs and symptoms you want to watch for, you want to watch how they're breathing, if they have difficulty breathing, right? See if they're using extra muscles, look at their color, pay attention to how they're acting, and, get a sense of if this is out of what's typical for them. So I think a pulse oximeter sometimes can be more distracting than helpful.
Yeah, I do tell parents that if they cause more anxiety than help in any way, then you want to avoid them. They're not a substitute for good adult supervision. And then just talk to your pediatrician to see if it's something that they might recommend. What about, can you have more than one thing at a time? So, for example, could you have RSV and COVID, or RSV and flu, RSV ear infection?
I mean, yes. A lot of times when we do that nasal swab, it's not just for RSV. You can also test for flu in a nasal swab and also for COVID. So you can send out multiple. There's other viruses we call rhinovirus, the common cold, or metapneumovirus. So there's like a lot of other viruses you could see on these panels. And we definitely have children that will have both. Will have 2 viruses. And sometimes those are your sicker kids, right? That I might see in the hospital because their body is trying to fight off 2 viruses at once. And then when you have a virus, and remember RSV is this just like mucusy, sticky virus. So a lot of times it's spread by air droplets, by coughing, sneezing, other things. But it's actually a virus that can like hang out on surfaces for up to an hour, especially hard surfaces it likes to hang out on. And so because of that stickiness, you can get other bacterial infections because of all the mucus. So things like pneumonia that I talked about, ear infections, sinus infections. So if you start to notice that fevers are really over several days, we say 3 to 5 days, you should really be calling your pediatrician for that too, for prolonged fever when you have a baby, because you want to get checked out for these other things too. So yeah, you can have multiple viruses, and then you can also get bacterial infections while having a virus.
You talked about the virus being sticky and being found on surfaces, so always encourage the good hand washing and keeping surfaces clean, especially for babies who are crawling around and touching things. When I was in training, we used to have to gown and glove up, mask, all the precautions for babies with RSV. Do you still do that, or do you cohort babies if they are known to have an infection like RSV, that they go into a different area of the nursery or ICU? How does that work these days?
Yeah, it really has not changed, Dr. Shu. I mean, we take it really seriously when someone comes in with a viral infection because we don't want it to spread to other babies. And I work in a NICU where we will admit babies with RSV. Some NICUs are closed off and won't do that. And so these babies wind up either in a PICU or on a general pediatrics floor. So they can wind up in different areas of the hospital. But one thing is that is the same is if you wind up in the hospital, they try to keep you in a kind of private room where you're not going to be around a lot of other babies or other children for spreading the virus. And then also, it's as you said, all the providers are going to put on gowns over their clothes. They're going to put on gloves. They're going to have on masks, and now sometimes eyewear as well. So they're going to be really geared up coming in, and that can be intimidating, but it's to protect everyone to stop the spread of that virus throughout the hospital. But the thing is, these viruses are in the community, right? So we're all just doing our best to try to decrease spread.
Right. So don't send your kids to school if they're sick because you don't want your, other kids to catch it, and vice versa. Let's talk about maybe some specific populations who might be more affected by RSV, communities of color, et cetera.
Yeah, I mean, we certainly see that in the data when we look at RSV infections, that communities of color, communities where, there's lower socioeconomic status, things like that can affect viral spread, just could be based on, where you're living, who you're living with. A lot of families are multi-generational, and that's going to be where you have more virus spread as well. And so that's why we want to make sure that we're talking about this, that we're having these webinars, that we're reaching all communities to give this information, because again, there's a lot you can do to help stop spread even maybe within your own home or stop spread within the community. And we also want people to feel empowered to go to the hospital or talk to their pediatrician, because sometimes these more minoritized communities don't feel as comfortable going to the doctor because it's hard for them maybe to find people that look like them that they can communicate with. So, I mean, we want to encourage everyone to go and want everybody to be aware of these signs and symptoms.
So one of the goals for today's talk is to talk about some of the exciting ways that we can prevent RSV, especially in infants these days. So can you tell us a little bit about what are these options that are available to us now?
Yeah, I mean, we opened this webinar talking about how this is the leading cause of hospitalization for babies under 12 months old, right? And I'm hoping that's something that really changes this year because we have new preventive strategies that are more widely available. I think a lot of people might have heard of them last year, but there was less availability. This year, really optimistic that there's good availability of these resources. So the first is that if you're pregnant between 32 and 36 weeks, you can get a vaccine for RSV, and that's going to be great. It'll give your body time to make antibodies to pass to baby to protect them when they're born. And then we give now something called nirsevimab, which is a vaccine, I said vaccine, you heard me kind of trip on that word. It's actually, we're trying to call it a medication because it's a little bit different than a vaccine. So with the vaccine you would get in pregnancy, your body would kind of read the instruction manual the vaccine gives it. It would make antibodies and those would be passed to baby. Nirsevimab is actually the antibody. So you're giving the antibody to baby. So it should start working right away, which is why we like it to give it to newborns right as they're born in the hospital before they go out in the community, so that they have a layer of protection before they go out in the community. And then it lasts longer than past antibodies that we used to use. Because I'm in the NICU, we actually used to use something called pavlizumab, which you'd have to give monthly to make sure there was protection. Whereas nirsevimab, we think lasts for several months of protection. So that's excellent, right? It's like less shots for baby and more protection for a longer period of time. And the other thing is when we think about protecting babies, we think about everybody getting vaccinated around them, right? So if mom gets vaccinated when she's pregnant, she's going to pass antibodies to baby, but she's also going to have a vaccine, right? So she's going to be less likely to get RSV. And now there's also a vaccine for older adults as well. So depending on who your caregivers are in the home, if they're over age 60 or over age 70, they may qualify for the RSV vaccine. And this was news to my parents when I had a baby last year, but I made sure that they got that RSV vaccine along with getting their flu shot and their COVID shot just because I had a new baby in the house.
Excellent. So yeah, very exciting to have these tools available this season. What are some ways that parents can stay informed and prepared to protect their babies with this coming RSV season, especially their first RSV season?
Yeah, especially this first season, right? Because it might be the first time that it's really been in your house too, especially if you have like a first child, where because kids tend to spread viruses a little bit better than adults do. So just staying up to date on vaccines. I think we already covered this, but making sure that you're cocooning your baby and having people around them that are all protected and vaccinated. And then when you have a newborn baby, it's really hard. I think we were touching on how demanding it is to have a newborn baby and the level of vigilance you have to have. And you kind of want to bring them out to public spaces. You kind of want to keep them more contained in places where you can control the people coming to see them and you're not bringing them out in public where you have less control about what people are doing for their viral spread. We can't overemphasize hand hygiene. It makes a huge difference. Just washing your hands. If you have other kids in the house, encouraging them to always wash their hands before they play with baby or touch baby. And then I'm a lactation consultant. There's a lot of benefit to breast milk, any breast milk that you can give, right? So any amount that you can give. There's not only antibodies in breast milk, but there's also other cells like white blood cells that can help fight infection. And so giving any amount of breast milk is really beneficial. It doesn't have to be all breast milk, but any amount that you can give in viral season is really helpful.
Excellent. Well, thank you so much for that great overview. We now have some time to go through the question and answer portion of this webinar. I thank everybody who either submitted questions ahead of time or are submitting them in our chat box right now as we speak. One question pertains to what you're talking about, fever in infants and thermometers. So just to reiterate, a fever is 100.4 or higher, but does it matter what kind of thermometer you use? And do we need to you add a degree if you take it a certain way? Or tell me about, what if parents don't feel comfortable doing a rectal temperature? What are some options for the youngest new babies that we see?
Yeah, I think having the thermometer is a checkpoint, right? To let you know, and you're only going to probably be taking your baby's temperature if you're worried, right, that they already have an infection. So I want to encourage anyone who's worried, call your pediatrician, talk to them about how you're using your thermometer in the moment. I think that question can also be answered in the moment, and you can get help while you're doing it. Certainly we always say rectal thermometers probably give us a best sense of temperature because they're internal. You want to just stick the tiniest bit of the tip in, so it's not something you have to really stick up in high into the rectum. But I think any thermometer, whether you use one that's under the arm or forehead, it's going to give you a reading, right? If you were to take it 3 times in a row, you're probably going to get a slightly different reading each time, right? So you can do that. You could check it a few times, but if you're ever close to 100.4 or over it, and you have a baby that's under 2 months, you take them in to get evaluated. You go to the emergency room. That's probably where your pediatrician will send you, but you can always call your pediatrician and ask them for advice, right? So it's one of the many checkpoints you can use to check on how your baby's doing.
I like that description of checkpoints. And I also encourage parents to look for a trend. So if they know that their baby runs a certain temperature, but it's gradually getting higher, then that's a trend that we might be concerned about. The other thing is it's mostly important how a baby looks. So we don't necessarily treat the number, but if a baby seems really ill, like they're laboring to breathe, or they're lethargic, or they're not eating and sleeping, those are signs that baby probably needs to get evaluated, even if the temperature technically might be normal.
That's such a great reminder, Dr. Shu. And also, if they're just not eating, not acting themselves, and they're really having a decrease in their diapers, that would be another time I'd bring them in for sure, even if there's no fever.
Excellent. Our next question comes from a parent of a premature baby, but this I think applies to all newborns. But how can parents tell visitors kindly, please not to come visit when they're sick?
This
It can be awkward sometimes, right? The family
yeah,
dynamics. Everyone wants to see the new baby.
And I respond to awkward by smiling. So that's what I did right there, right? Because it's really hard. I mean, this is a hard thing because you want to share your baby with people. And especially if you've been in the NICU and had a premature baby, going home is such a big milestone and being home with your baby and you need support as a new parent too, right? So it's hard to be in that baby bubble protecting baby. So everybody's got a little bit of a different risk tolerance, but some universal things that I like to follow is no one should visit if they're sick, right? So even if it's just like, oh, I have a tickle in my throat, like you can wait, a few days to see if you are getting sick or to make sure that you're feeling better. If they have to come over, if it's necessary for care, masking is actually effective in helping someone stop spreading the virus to somebody else, right? So that's still a strategy even in this post-COVID world that I would recommend if they have to come and someone's not quite feeling well, right? I think also making sure that everybody's vaccinated who comes. I remember sending out emails to friends and family, making sure that they all got their vaccines, and especially for premature babies, because premature babies are still developing even when they leave the NICU, so they need those extra levels of protection to help them. So making sure everyone's vaccinated. Cannot emphasize hand hygiene enough, right? Remember, RSV in particular, a sticky virus, likes to live on surfaces. And when we say hand hygiene, because we say that a lot, we mean like soap and water and washing for 20 seconds. And for some reason, doctors get caught in these grooves of mentioning different songs, and Happy Birthday tends to be the song we tell people to sing themselves when they're washing their hands. So that'll give you, or you could count to 20 in your head, 20 seconds. You want, 20 seconds of really good hand hygiene, and you can see me kind of doing it with my hands, like getting in between your fingers, that's why it takes 20 seconds, because you want to get all the surfaces of your hands and make sure they're really clean. And and I also say, like, you don't have to have it's coming on winter time, so it's going to be colder in a lot of places, but you don't have to have the visit inside the house. You could be on a porch with a heater or out in a park, just so people can see baby, and then baby could be, in a stroller or kind of like a little bit away. But being outside is going to mean that you're not all closed in together sharing a virus too.
Excellent. Let's talk a little bit more about the vaccine and vaccine for adults. You talked about how people over 75 are eligible to get it if they're over 60 with certain medical conditions also, and then pregnant people from 32 to 36 weeks of gestation. But is the RSV vaccine recommended for all patients, all parents, the way we recommend maybe flu shot and the Tdap shot at this point? What are your thoughts on that?
Oh, Tdap, that's a good one to bring in too, because you really want to, and we're seeing increased rates of pertussis around the country, really. So it's important to really get that shot too. But flu, COVID, also important. I wish that it was approved for all age groups, and for everybody, that they could get it every season. That just hasn't happened yet. I think it's pretty new, the vaccine. And I think this is an area of medicine where we're going to see changes in the next few years. So I am hopeful they're going to open it up to more people. But right now, the pregnant and older folks are the ones who are eligible for the vaccination.
Excellent. Thank you for that question, David. Let's talk a little bit more about the vaccine for pregnant people from 32 to 36 weeks. It currently is recommended only during the months of September through January. Is that correct? Why this strict time frame?
That's when we see RSV. So COVID, the year of COVID really kind of changed things, and we were seeing RSV a little bit out of season, but things are starting to be back in sync where we're really seeing RSV in the fall. It tends to start to really peak in October. And, it's different than the flu. The flu actually peaks a little bit later when we start to see it in the community and lasts a little longer. But those months are when we really think RSV circulation is going to be at its highest, because that's traditionally when it is. And so that's why in July, you don't really need the protection as much as you're going to need it later on. But what's nice is if you already had your baby, now up to 8 months, your baby can get nirsevimab. So your baby can still get antibodies in the winter. And we say up to 8 months, I think, to get the most at-risk babies, the youngest, through the winter season.
So let's say a pregnant person or a baby has been diagnosed with RSV. Will they still need the shot?
That's a great question. And it's kind of two questions in one, right? So if you're pregnant and you had RSV, you're probably going to have circulating antibodies. And so, you'll have to talk to your provider about timing of a vaccine in that scenario, depending on how far you are from delivery and other things. So I think there's a little bit more calculus that goes into pregnancy. But if your baby has had RSV and they're over it and they're feeling better, we don't know how long those circulating antibodies will hang out in the baby. And so I think it's still a really great idea to get nirsevimab, because then you can extend their immunity. And a lot of places I know, and you can speak to this, Dr. Shu, with your general practice, will give it typically a few weeks after an infection. And I don't know if that's how you're doing it, Dr. Shu.
That's exactly how I'm doing it. Let them get out of that initial acute infection stage and get better. It tends to be about 2 to 3 weeks later. Let's talk about that RSV shot, nirsevimab, in babies. Is it safe? Are there any known side effects? Does a baby need to be a certain size, age, weight to be able to receive that?
Yeah, that's a great question. So right now, the side effects that we're seeing most commonly are just pain at the injection site, or maybe some redness, bruising, swelling at the injection site. We're not really seeing many what I call systemic or full body sort of reactions to this, which is a good thing, right? So those are kind of the most common things that you'll see. So we think it's a really well tolerated antibody injection, that babies do really well with. So that's why we recommend it so universally to so many babies. And there's not really a weight cutoff. Typically in the NICU, we have babies that'll be there for a really long time, right? Like, so we'll have babies born at 23, 24, 25 weeks that'll stay. And so we typically tend to give it, when babies are more at term and going to leave the hospital, so a little bit bigger. So, that's why there's not like a set weight cutoff, because if you're taking a late preterm, that's at 35, 36 weeks, early term, 37 week, 38 week baby home, you're going to qualify for the injection. And then if they're going to their pediatrician, they're going to be at a weight where they qualify for the injection.
Okay, excellent. What about infection control and contagiousness? So let's say your child tests positive for RSV. How long do they need to stay home from school, or do they even need to stay home from school? You said that RSV can be like a common cold, and if we kept everyone with a common cold home, nobody would ever go to daycare or school.
Yeah, this is really hard because there's a practical side to parenting where you might need your kids in school just for their own socialization or for your work or other things, and maybe they really enjoy school and they want to be there. You can be contagious for, over a week. We say somewhere in like the 1 to 2 week period, you could still be contagious. You can even be contagious though before you have symptoms, right? So it's a tricky question. We usually say follow whatever protocols the school has or the daycare has. Some say, don't come if you've had a fever and wait to be fever free for 24 to 48 hours. That tends to be the typical. And then if you know that it's RSV, then you know that there are things that you could do to help stop your kid from spreading it, right? So you can really, again, emphasize their hand hygiene. You can let the teachers know that they're feeling better, but they had RSV, so the teachers can help emphasize their hand hygiene and other things. And then again, I know not everybody loves to mask, especially with younger kids. It's really hard to mask. But thinking about that and thinking about ways that, they can make sure to cover their cough or their sneeze, cough in their arm, right? Not on their hand. So telling them different preventative things so that they don't go spread it to the whole class. But you certainly don't want to keep it a secret, and you certainly want to follow the protocols that your school or your daycare has in place.
One thing you mentioned earlier that is that with RSV, you could get a complication such as pneumonia. And so this audience member asked, if you test positive for RSV, is there a need for a chest X-ray in all children to see if there's a pneumonia or not?
No, because even, when you get a chest x-ray, sometimes it can lag behind the clinical findings of a pneumonia too. So we don't even really use chest x-rays at baseline to necessarily diagnose a pneumonia. Sometimes it's helpful. So it's not something we recommend universally, right? I think it would depend on your child's signs and symptoms, right? I mentioned like having prolonged fever as a sign of possible pneumonia, not having improvement, throughout the course of the virus and still having difficulty breathing can be a sign of pneumonia, and that might warrant you starting to get chest x-rays to look for it. But really, we're going to follow clinical signs and symptoms in your baby and your child to determine whether or not they need antibiotics.
One question I get asked sometimes is whether a child can get RSV more than once. and whether there can be lasting effects from RSV, because RSV can sometimes give you wheezing, which sounds like asthma. So I don't know if this is within your wheelhouse, but can RSV make you more susceptible or prone to having asthma later?
Yeah, that is something we are still studying, that we're still curious about, that having these kind of like in this inflammation and these infections early in life, how do they affect your breathing and other things later on? But at this point, if you get wheezing and sort of, that from the RSV, you should get better once you overcome the infection or get treated for a secondary infection like a pneumonia or something like that. And that's a great question because I think we're still looking into that, but a lot of times, and this is worth mentioning, kids get sick. Kids can get 9, 10 viruses, in especially, throughout their first year of life too. So that's why we also want to empower you to do the supportive care at home, to be watching them at home when you can, because unfortunately, like kids, again, because they can't follow hygiene and distancing and other things like we can as adults. And so it's always important to mention that like kids do get sick. And so we're hopeful that it doesn't increase their risk of being sick later on. There's work looking into that, but you should be able to overcome this virus and be healed from it. And
What do you
genes
think?
play a role in that, other things.
Oh
Yeah,
yeah,
I could talk
genetics
about
for
that
sure.
forever, Dr. Shu. Yeah.
Maybe that'll be our next webinar with you.
Yeah.
What about environmental factors? I mean, you talked about things like breastfeeding and vaccines and things, but what about smoke, cigarette smoke, for example, or vaping in the environment, or fireplace smoke, or allergens, mold? Do you see any impact on children with RSV or basically any respiratory illness?
Yes, I mean, we do. I always, and this is something I tell families of premature babies, but also holds for families of term babies. The lungs are an organ that is continuing to grow even after you're born. So there's a lot of lung development that happens even into kind of early adulthood. And so exposures to things that could, halt or alter that lung development, things like you were mentioning, cigarette smoke or mold, like we certainly think that could have an impact on health later on too, which is, and it could make viruses worse as well, because if you already have kind of inflammation or other things you know from secondhand smoke and other things, it could make the virus that much more acute, or severe. And so we want to be mindful of those things too. So that's actually great, Dr. Shu, to add into just thinking about the environment and making an environment that's going to promote good, healthy lung growth for kiddos.
We just got a question in about long-term effects from having pneumonia, RSV, COVID, et cetera, if you're a baby or under age 5. And you did talk about how some of the stuff we just don't know yet. But what about somebody who's had pneumonia as an infant? Are they more prone to that later? Does it somehow cause a permanent impact in the lungs to make them more susceptible?
I'll say this, hopefully not, right? I think babies are more resilient, than we think they are. And I've seen babies who've been really, really sick, from infections go on to lead like long, healthy lives, right? I have the privilege of seeing a lot of my NICU grads at reunions and other things. And so I think the answer is hopefully not. Certainly if your child has multiple infections that just seem out of the realm of what typical children get, that could prompt you talking to your pediatrician and talking to specialists like immunologists to make sure that this isn't something that's going to affect them later on or has to do with their immune system. But babies and kids are really tough. A lot are going to get better when they get sick. And that is why we love pediatrics, actually, because a lot of the kids that we treat get better and do really well.
Absolutely. I think that's a really important point to make. I feel like a lot of parents kind of get freaked out if a baby has pneumonia because maybe they've heard of a grandparent who had pneumonia and it was super serious. I would just remind parents that a lot of babies get RSV, a lot of babies get pneumonia, a lot of babies get COVID, and the vast majority of them do completely fine afterwards without any, long-term effects. So try to be reassured that yes, while RSV and other things can be serious, in general, most infants do extremely well later on. Another question we have is, are there any rashes associated with RSV that parents should be aware of? And this comes from audience member named Vanessa.
All right, Vanessa, that is an excellent question because when we talk about babies, I joke that the only thing that can sometimes make their skin look good is Photoshop because they're prone to like many different rashes, and there's a lot of viruses that will cause rashes. There's not a typical RSV rash. So that for me would not be diagnostic of RSV if they had a rash. But certainly, even having a fever can make someone look a little bit more flush, right? And make change the tenor of their skin. So we're always looking out for rashes, and there are some viruses that have characteristic rashes, but RSV is not really one of them.
I do get questions about whether there are certain foods that people should avoid. So let's see, does milk make you more mucousy? And you've already said that RSV is a sticky illness. So do babies who are on regular milk, do they need to avoid milk products? Things like that. Is there anything, do they need to be on Pedialyte instead of breast milk or formula? So I get questions like that a lot. Any thoughts?
No, I mean, under 12 months, certainly like under 6 months, let's start there. You really want them to be taking milk in some form. That's how they're going to hydrate. That's how they're going to get their nutrients. And, 6 to 12 months, you have a little bit more play of what kinds of liquids you can be giving, right? But in that 6 to 9, it's still going to be a lot of milk, and I think and I think there's some lore that milk causes more mucusiness, but really it can be a really good way to hydrate. There's not really good proof that it is going to make you more mucusy. The mucus is going to be from the virus and your body fighting off the virus, not from the ingestion of a dairy product, right? And these kids aren't feeling well. So you're going to want to offer them foods that, this is a time where maybe you'll be a little bit less strict about, the amount of vegetables that they're eating, right? Because you're going to want them to feel better. And so you got to give them foods that they're going to eat. And if milk is what they love in that moment and you want to keep them hydrated, I would go ahead and give it. There's not evidence really that that's going to make them more mucusy.
Excellent. One thing I just wanted to add to a question that we had earlier about daycare or school return is, yes, they may be afebrile and feeling better, but are they feeling well enough to make it through the day to get through their regular activities? Are they coughing so much that they're going to create extra work for the teachers to have to pay attention to them, as opposed to the other students? So just wanted to add that and see if you have any other parting words before we hand things back over to the AAP.
I think it's just to say that, I think everybody gets nervous in viral season. I think this is a really good time to partner with your pediatrician. You can always call if you're worried about any signs or symptoms. You can always make appointments. We pediatricians think of pediatrics as a winter sport, and so we are active and ready to be seeing kids in the winter because we know this is the time where everybody's in close quarters, everybody's back at school, everybody's in groups, people are going to get sick. And so we want to support you through that. So please don't hesitate to reach out and use a lot of the resources from healthychildren.org because using them, you'll see a lot of really great evidence-based guidelines for how to manage sicknesses at home.
Excellent. That's all the time we have for questions. Now I'll turn things back over to the AAP.
Thank you so much, Dr. Shu and Dr. Parga Belinkie. That was really great information. We'd also like to remind participants to register on healthychildren.org for our e-newsletter. You get a personalized homepage if you would like, and special offers. And don't forget to follow healthychildren.org on Instagram, Facebook, and Pinterest. You can also subscribe to our new Healthy Children podcast. You can find it wherever you get your podcasts, or you can just go to healthychildren.org/podcast. We hope you enjoyed today's webinar. Please look out for a quick survey and let us know what you found helpful and what suggestions you may have. We also want to extend a special thank you to our sponsor for today's webinar, Sanofi.